The veterinary profession is facing a growing problem of affordability of care. And to address this issue, our community is embracing the concept of the spectrum of care. The aim is to provide veterinary clients and their pets with a range of viable healthcare options, from least invasive and economical to more advanced and higher cost. The main goal is to practice evidence-based medicine while meeting the needs of patients and providing satisfactory outcomes to their owners. So how do we do it right? The keys to success lie within relationship-centered care, honest and clear communication, and education. In this video, we'll go through a good example of a veterinary visit that shows how we can use the spectrum of care for the benefit of our patients. We will also go over questions to ask your veterinarian for the best experience for you and your pet when visiting a veterinary hospital. Let's take a look.
Hey, so what brings you and Marcy in today, other than our delicious treats?
Well, I was concerned because I've noticed over the last couple of weeks that she's been asking to go out more.
Sure.
And waking us up in the middle of the night. And when she urinated today, I noticed some blood in the urine.
Oh my goodness, I'm so glad you brought her in. That sounds
Yes.
pretty concerning.
Yeah.
And then when you took her out this morning and saw that blood, any other behaviors, any other signs that you noticed when she was walking that I should know about?
She struggled a little bit before she started to urinate.
Okay, like meaning she was straining a little bit?
Yes, yep.
Okay. Would you happen to notice, sometimes it's tough to say, if she was urinating like a large amount or small amounts?
Small amounts.
Small amounts.
Several times.
Great, okay, that's really, really helpful. So here's what we're gonna do. I'll grab some more treats, and then we're gonna get started on taking a look at her.
All
Let's
right.
see what we can find.
Thank you.
So I do notice she's a little bit more tense around the area of the bladder.
Okay.
And that kind of does fit with what you're telling me is happening at home. And there are a lot of things that can cause blood in the urine, and we're gonna talk about a few of those. But most commonly, something called a UTI, or a urinary tract infection.
Okay.
Right?
So I do have a little history. I brought my cat in with kidney issues several months ago that did cost me a lot of money. So I don't know, like, how we'll be able to take care of today.
First of all, thank you for sharing that. We have a lot of options we can talk about. We don't have to do everything today. Let's go through it and see what you're most comfortable with.
Okay, thank you.
So this is why history and physical exam are so incredibly important in creating a diagnostic and treatment plan for our patients. Marcy is an otherwise healthy dog. And while we would love to have a urinalysis, sometimes financial constraints are present and we can't pursue that option. So we elect to treat empirically, meaning we give a medication to treat a possible infection, which we think is most likely in Marcy's case. Then if there's no relief in a few days, or things get worse at any time, she can come back and we could talk to her about running that urinalysis and doing additional testing that might help figure out what's going on with Marcy. So let's talk options, okay? Our first step could be, honestly, just starting her on some antibiotics. That's an okay option today. And we would see if that's helping her and go from there. We also could take a urine sample, and that will help us because we could submit it for what's called a urinalysis and a culture and sensitivity. So what does that mean? It means I will look in her urine, the lab will check and get me some results. They will tell me how much blood they see and if there's bacteria in there. And not only that, if there is, what antibiotic would be best used to fight that infection.
Marcy, what do you think? Should we just try the antibiotics? Will that make her feel better?
Well, if we're on the right track, it really should make her feel better. And actually, it will make her feel better quite fast. In the next couple of days, you should see some significant improvement.
Okay. And if not?
So that's a really good question. If she's not improving or she gets worse at any time, right? So more blood, more squatting, maybe licking, or she shows other signs of not feeling well, right? Not eating or being tired or anything else, well, you have to call me right away. And then we're probably going to discuss those other steps that I mentioned today. Things like that urine analysis and that culture and sensitivity, and maybe even blood work if she's not feeling well.
Okay.
So today the plan is we're going home on our antibiotics, right? And I will have a technician that will call you in just a couple of days just to check in on Marcy and make sure everything's going well.
Okay.
Are you comfortable with this plan?
Yes, I think I'm comfortable.
Great. Are you comfortable, Marcy?
Marcy is definitely comfortable.
I'm glad. Glad to hear it. Patient care is a team sport. Working together with your veterinarian will help you achieve the best outcome for your pet. The first step in doing so is asking the right questions. So, what should you ask your pet's doctor? Well, how about, can you explain your thought process to me? Why do you think this disease is most likely going on in my pet? And where can I learn more about this condition? How about, what's the best first step in finding out the problem? And the treatment. And if that treatment doesn't work, well, what are my other options? And if medications are prescribed, what is this medication? And how does this medication work? And what are the risks or side effects associated with any medication my pet gets? And if I see my pet getting better, can I stop the medication or should I continue? Is a follow-up appointment necessary? And if it is, when should I bring my pet for this follow-up? And are there other options for follow-up? Remember, it's always better to ask rather than to guess. It's our goal to make you and your pet feel completely cared for. We want to answer your questions, so please ask them.
In this example, the veterinarian had a good step-by-step approach to her patient's care. And Marcy's owner did a great job asking the right questions. Together, they developed a treatment plan that worked for Marcy and her family. Embracing the spectrum of care will help achieve better patient outcomes, support pet-owning families, and give veterinarians more confidence in their practice.